to the lecture series for head and neck. In reality, it's a short piece just to introduce the paranasal sinuses. But to do that, I want to spend a couple of minutes just revising elements that make up the nasal cavity and the fundamentals of the nasal cavity. We did cover a little of this earlier, so this part shouldn't actually be too new. As I pointed out during my lecture series, the facial skeleton is made up of a series of bones, and its shape and structure and arrangement is driven by its function. Clearly, the cranial vault is fundamentally the protective bony structure to protect the delicate structures of the brain and spinal cord, or the beginnings of the spinal cord. Whereas the facial skeleton has the driving functions of breathing and eating and carrying the special senses such as the eyes. And therefore its structural arrangement is quite different to the cranial vault. The primary part of the story of the facial skeleton is its role in modifying air on its journey through the nasal cavity, and this is where the paranasal sinuses become important. It's not actually the bony shape that's important. What is important is that this bony shape maximizes the surface area and provides a region where the air can pass across the respiratory mucosa on its way towards the lungs. And remember, in our respiratory talk, we spoke about what happens further down the respiratory tree once we pass through the trachea. But for now, we want to remember that the respiratory mucosa that lines the nasal cavity and the paranasal sinuses is there to warm, to moisten, and to clean the air on its journey around these surfaces. And thus the fundamental structure of this nasal cavity is to increase that surface area. And therefore, we see the nasal cavity split in two with a nasal septum. We see a series of bony extensions hanging out from the lateral wall of the nasal cavity called conchae, and these conchae are purely there to increase that surface area within the nasal cavity. But important to this key little addendum is we then have subsequent spaces that are off from the main nasal cavity with little openings that allow the air to flow into these spaces, and that's what we call the sinuses, the paranasal sinuses. All of these sinuses, just like the nasal cavity, are covered by respiratory epithelium, and we have the largest being the maxillary sinus, and then a subsequent set of smaller ones called sphenoidal, ethmoidal, and frontal air sinuses. These sinuses extend out from the nasal cavity, and even within the sinuses themselves, they have little bony spicules that carry increased respiratory mucosa and therefore increase the surface area even within some of these sinuses. And this way, we end up with the air turbulently flowing around these spaces, and the fundamental function, reminder, is to warm, moisten, and clean the air. And remember that, as I said before, respiratory mucosa has goblet cells that produce the mucus that lines on the surface and is highly vascular as well, and therefore this respiratory mucosa can allow evaporation of moisture from the mucus. The mucus, being sticky, can collect any macroscopic debris from it, and the high blood supply will provide a temperature regulation that can modify the temperature of the air. And the sinuses are spread throughout the facial bones and extend into the frontal bone, which technically you could also call part of the cranial vault as well. Please do note that in forensics we sometimes use the shape and the structure of these sinuses as a measure of identifying skulls when we find them. They are very different, and their extension is very different in all individuals, and that gives a relative uniqueness that we can use in identification. And a classic example of this is the spaces that we find in the frontal air sinus. And when you actually look at the quantity of bone in the facial skeleton relative to spaces, be it oral cavity, nasal cavity, sinuses or orbit, you can actually see the amount of bone that makes up the front facial skeleton is relatively low. And thus its fundamental conundrum about the way it manages loads when we chew on it versus loads that come horizontally if we have an accident and hit something in our face. Our ability to manage loads on these delicate bones is very different in the different dimensions that forces are applied. And sinuses we can see clearly on standard radiographs, and here is a great example of the maxillary air sinus, looking dark because it has a low density of bone, and therefore the X-rays can travel through it, and thus you get a darker area than where you have bony structure. And here you can see the maxillary air sinus sitting immediately above the maxillary teeth, and it fills the vast majority of the body of the maxilla. And in a lateral view, you can see the other sinuses here, for example the sphenoidal air sinus sitting just below the pituitary gland. You might be able to see, if you look very closely, a little white arrow there with a number 4 on it. That is actually pointing at the pituitary fossa where the pituitary gland sits. This sphenoidal air sinus is actually relatively large in this particular individual, probably larger than we would normally expect to see. And at the very top of this you can see the frontal air sinuses a little bit in the beginnings of the frontal bone. And in another view, this is a coronal section, and you can now see the ethmoidal air sinuses sitting between the orbit and the nasal cavity, and that has those lovely little extra shelves of bone that makes the ethmoidal air sinus somewhat cellular in appearance. All of these cells are joined together by little foraminae, and these foraminae allow the air to flow through the cells and therefore modify its temperature, moisture, etc. Again, we can see the maxillary air sinus in this horizontal section. The large black area towards the middle here is actually the pharynx, so you can see its relationship there. And please note, this one shows a common condition that we all suffer on a regular basis, and that's some sort of inflammatory reaction within the respiratory mucosa of, in this case, the maxillary sinus. But obviously you can get it in any of the respiratory mucosa. Clearly a lot of antigen is associated with this region, and therefore the risks of infection are high. The other important thing to remember is when you get this sort of inflammatory condition, sinusitis, when it's inside a sinus, that the thickening and the increased release of mucus can actually block some of the drainage holes, or the holes that allow flow of air and things through them, and this can cause pain because of the build-up of liquid pressure and things within these sinuses, and thus you get the common feelings of sinusitis. The nasal cavity and its associated paranasal sinuses get innervation. Clearly the olfactory nerve, the smell sensation, special visceral sensation of cranial nerve 1 is limited to the nasal cavity, but obviously the rest of the region gets general somatic sensation, all of which will come from branches of the trigeminal nerve, remembering that GSS is our pain, temperature, touch and proprioceptive components of the mucous membranes and bony areas of these paranasal sinuses. And the other part of the innervation is the pieces of functional component, greater visceral motor, being parasympathetic and sympathetic, that the parasympathetic, I remind you, doesn't fundamentally come with the trigeminal nerve. It's an add-on from its neighbouring cranial nerves that have that function. And please do go back and look at the fantastic freeway diagram that explains where those components come from. That is the general visceral motor parasympathetic components of cranial nerves 3, 7, 9 and 10. And then remember, all the blood vascular supply to the paranasal sinuses and the nasal cavity come, and remember that's a GVM component as well, but they originate from the outflow of sympathetic from the thoracic region via the sympathetic chain and then follow the blood vessels. So the sympathetic component fundamentally follows the blood vessels. And here we have that in summary: olfactory, limited to the top little part of the nasal cavity, over onto the septum as well, and the roof. And just quickly now, there's the olfactory nerve, cranial nerve 1. Remembering I told you before that cranial nerve 1 and 2, really we should change their names. They're not actually sort of nerves in the purest sense. They are brain tracts. They are extensions of the brain and sit most of it sits behind the blood-brain barrier. And just as a reminder, the vast majority of these paranasal sinuses, and you can see a cut window into the paranasal sinus here with the red respiratory mucosa showing through, but the vast majority of this is supplied by the maxillary division of the trigeminal nerve. And as I said, that part of the trigeminal nerve is purely general somatic sensation with the add-ons of the general visceral motor component, but it doesn't, as I remind you, contain any of the special visceral motor component. That is limited to the mandibular division. So the maxillary division supplies general somatic sensation to most of the paranasal sinuses, and in particular, in this case, we're talking the maxillary air sinus. And again, to remind you, the major blood vessel supplying almost all of the structures of the facial region is the maxillary artery, and branches of the maxillary artery extend with the mandibular division of trigeminal nerve and with the maxillary division of trigeminal nerve, having the same names, to supply the paranasal sinuses and nasal cavity in their respective regions. I also note on this is the anterior ethmoidal artery, a small supply to a little area of the nasal cavity as an additional story, but that is not a priority. Please don't spend your time learning the anterior ethmoidal artery. So I just want to finish with a couple of slides, particularly to remind you, because you are going to see patients like this or friends and family who've had this. You may even had this yourself. The maxillary air sinus sits extremely close to the roots of the maxillary teeth. In fact, sometimes the roots of these maxillary teeth point through into the maxillary air sinus. I've actually extracted an upper molar tooth and looked up through the remaining socket in the alveolar bone and looked directly into the maxillary air sinus. This is not an absolutely unheard of complication of extracting upper teeth. The other complexity with the proximity of the maxillary teeth to the maxillary air sinus is when we now try to place osseo-integrated implants. For those not in the know, these are what was commonly called screw-in teeth. These are titanium implants that integrate directly with the bone and are used to hold up bridge work to make artificial teeth. But these implants, as you drill them in, you run a grave risk of getting into the maxillary air sinus. And the fantastic thing I'll tell you about your generation is the amazing new three-dimensional radiography and the electronic systems we now use for drilling holes to place these sorts of placements, we have drills that now are computer controlled and use the data from three-dimensional CT scans to control the location and depth of the holes, so you actually are prevented by the intelligence within the software from damaging the maxillary air sinus. So that's where I'm going to finish my little addition to the stories that I've told so far in the lecture program. I do hope this has added a nice little story about the paranasal sinuses to complete our journey. Thank you.